Good morning, everyone. My name is Dr. Lilian Ekpo. I'm the Center Director, NSIA LUTH Cancer Center, situated here within the LUTH compound at Idiaraba. Today I'll be educating us on some few things about cancer, what it is, and what you can do to prevent it, in a sense. So what is cancer? Cancer occurs when we have abnormal growth of cells within the body. Generally, as cells are made within the body, the normal process is that those cells will grow old and die, which is why, normally your head would fall out naturally. It doesn't mean that you're ill, just a normal process. The cells grow old and they die. But cancer occurs when that process, that natural process, is distorted in some way, and you find out that these cells, rather than dying, even though they're abnormal, they're damaged, they continue to proliferate and they invade other healthy tissue. When that happens, cancer develops. Now, what are the causes of cancer? There's no one specific cause. Cancer doesn't have one thing that causes it. It has multiple risk factors. So the more you can do to modify these risk factors, the less the likelihood of your developing cancer. And some of those, I'll just mention maybe like the top 5. One of them is genetics, because really the abnormal growth of cells occurs when there's some modification in the genetic makeup of those cells. So cancer is, in a sense, is your genes, is the genes being altered. There are some genes that are inherited that people have that can lead to cancer. I'm sure we all would remember the actress who had her breasts, taken out, had a double mastectomy, which is mastectomy is the removal of breast tissue, because she had her mother who already had cancer. So that is because she had the genes, so she wanted to prevent the likelihood of her developing breast cancer, and she had her breast taken out and had, artificial breast inserted. So that people that already have those genes, and once you have those genes, the likelihood of your developing cancer increases. Other things that will cause cancer would include things like your lifestyle. So excessive tobacco consumption, smoking would increase the likelihood of developing cancer. Alcohol ingestion, excessive alcohol ingestion would increase the likelihood of developing cancer. Obesity. Are you overweight? And obesity is, again, multifactorial. So a sedentary lifestyle, little physical activity, consumption of a poor diet, a high-fat diet, all those sort of things would predispose one to obesity, and obesity therefore is also a risk factor for cancer. Infections and inflammation. There are 2 top infections that will come to mind. One is hepatitis, and the other one is the infection with the HPV. It's called the human papilloma virus. That's the main virus that's implicated in the causation of cervical cancer. And cervical cancer is a very common cancer. In fact, the second most common female cancer, most common cancer in females in Nigeria. So those are some of the risk factors for cancer. Other things would be exposure to toxic substances, such as some pesticides, even unnecessary exposure to things like radiation, having unnecessary X-rays and things like that. Those sort of toxic substances can predispose one to developing cancer. What I would say then would be, okay, now we know what causes cancer. We can then ask ourselves, how can I protect myself, in a sense? How can I, ensure that this doesn't happen to me? Being that there's not one thing, it then means that there are multiple things you can do to ensure that you help prevent yourself or protect yourself against cancer. And I think the top thing is having a healthy lifestyle. A healthy lifestyle will involve physical activity. You need to move. A lot of jobs that people do nowadays, and especially with the advent of technology, there's a lot of sitting. If you're doing a desk job, for example, you're in meetings all day long. Sometimes the weather, especially in our part of the world right now, is very hot. Nobody wants to walk around, when the sun is hot. But you actually need to move every single day. Find a way to get some sort of movement into your schedule. So rather than taking the lift, for example, if you go into a building, you could take the stairs. If you are driven, if you're driven, you could come down a bit further away from your destination and get down and walk. If you drive, you could find a way to maybe park your car a bit further away from where you're actually going and find a way to walk. So those sort of things, consistently help us around, while you're in your office, find a way to move, to get up, walk around, After lunch, you could take a walk, things like that. So movement is important. Your diet is absolutely key. One of the risks of cancer is, like I've said, what you consume, what you eat, and it's very important to eat a healthy diet. What is the definition of a healthy diet? I know from school we learn everything about a balanced diet, the right proportion of proteins, carbohydrates, and all that, but a healthy diet is beyond that, is defined beyond that. As much as possible, you need to get your 5 a day, and that's just a short way of saying 5 portions of fruits and vegetables a day. Try to eat all the colors of the rainbow as much as you possibly can. Bell peppers, there's the green, there's the red, there's the yellow, there's even the orange. Cabbage, for example, there's the white or slightly green, and there's the purple one. So you can do even sweet potatoes. There's a white variety, there's orange variety, there's a purple variety. And that, spectrum of colors, they all have different sorts of nutrients and things. One thing I must say about diet is that a lot of people say eating healthy costs a lot of money. But in the end, you need to think of this fact that cheap is more expensive in the long run. If you're eating a cheap diet, you're not thinking of what's the kind of oil that is used to cook this food I'm eating. What kind of ingredients are in the food that I'm consuming. In the long run, by the time you've done damage to your health and to your body, you find out that you're spending so much on medication, so much on medical bills, you're practically miserable. You're trapped in an unhealthy body that is bogged down with so many medical conditions. So it's better to spend the money now. And in the end, you find out that a lot of these things are not that expensive or as expensive as we think. Pawpaw, for example, eat the fruits that are in season. There's the rising cost of food prices is a global, problem, but I'm sure you can find 1 or 2 things in our environment. Sweet potatoes, for example, are not that expensive and they're very, very healthy. So those are the things you can eat. You can eat bananas, cucumbers, like I said, eat, the whole spectrum of the rainbow. The other thing to include in your diet is things that are sort of like anti-inflammatory, and by inflammation, when you say anti-inflammatory, they help fight. They have some cancer fighting properties. So I'll say things like turmeric, ginger, if you could include them in your foods. Onions, for example, especially the red onions, they have quercetin, and quercetin helps fight inflammation in the body. All those, tiny substances, they're called flavonoids. They're included in foods. Things like berries have antioxidants. Antioxidants are substances that help, reduce the likelihood of you getting cancer. Berries, blueberries, blackberries, strawberries. And thankfully now, with they add a lot of investments in agriculture, we have these things made locally. There are strawberries that are grown in Jos, there are grapes that are grown in Nigeria. Not everything is imported. So you can actually get a lot of these foods and make sure you eat healthy. The other thing is to avoid the things that are likely, those substances that are damaging and can cause cancer. So don't smoke. Reduce as much. If you already drink, please reduce your alcohol consumption. If you don't drink, then that's fantastic. If you can't stop drinking, that's even more fantastic. For people that say, oh, I'm struggling, I've always done this, it's going to be difficult for me to stop, maybe because of my habits or the kind of friends I associate with, then you can significantly limit alcohol ingestion, because alcohol ingestion is connected with a number of cancers, liver cancer being one of them. Get vaccinated. So cervical cancer is one of the most preventable cancers in the world, and when caught early is curable. So and there's a vaccine against human papillomavirus, so get vaccinated. If you need whatever hepatitis B vaccine as well exists, so you could get vaccinated. You should get vaccinated for that, so please get vaccinated. Sleep is healing. When we sleep, that's when the body sort of repairs itself. So remember at the beginning when I was saying what causes cancer, I talked about the cells are supposed to die naturally and how cancer is a deviation from the norm. Sleep helps that normal process, just sort of, it's like cleaning out. It's like a building that is shutting down at the end of the day, and you're sweeping and the cleaners are going around and mopping. So you can imagine if you were working 24/7, there would be no time to clean. So that's what happens. You need to sleep so that even your brain, lack of sleep increases the risk of having dementia early. And to all the people, so this message goes to all the people that say, oh, they thrive, especially executives in this technology-driven world. People are happy to say, oh, I just do 5 hours of sleep a day and I'm so productive. You need your good sleep. at least 7 hours of sleep. For people that say, oh, how's that possible? I live in Ikorodu, I work in VI. As much as possible, try. Because you have only one life. You have to find a way to make adjustments in your life so that the quality of your life is actually something that you enjoy. It's not just to exist. Are you enjoying the life that you have? So make those adjustments so that you can get some good sleep. So I'll say those are some of the things that you can do. Reduce your stress. Stress is not just, ensuring that you have good sleep. Don't hold on to things. Sometimes people are different things happen, and some people don't know how to let things go. They're anxious, they're holding on to stuff. Having that sort of peace of mind and mindfulness, we may think of it not as something significant. I'm not saying that people that are bitter, that's what led to cancer, but I'm saying you ensure just peace on the inside of you generally. Your mindset is a significant factor in the development of disease. So it's important to have that, because you can sleep and your mind and your body are not rested because there's so many things on your mind. That ability to sort of de-stress and decompress, is essential, and it's an essential part of a healthy lifestyle. So let's just talk a bit about the common cancers. Globally, the most common cancers, the top 4 would be lung cancer, prostate cancer, and I'm mentioning both male and female. Lung cancer, prostate cancer, colorectal cancer, and breast cancer. Those are the top 4 globally. In Nigeria, in women, top cancers, breast and cervical cancer. In men, prostate and colorectal cancer. But you can just put everything together and say top 5 Nigeria cancer and colorectal cancer. And so you see, we're not, the only thing that sort of differs from what we see in Nigeria is lung cancer. And I think that's probably because they have a higher incidence of tobacco consumption in other parts of the world than we do here. But cancer it's a real and present danger. It's here now in lower middle income countries like ours. It's not something that was far off. It's only white people that get it, or it's only Caucasians that get it. I mean, right now the numbers of patients that come down with either breast cancer or any one of these top 4 that I've mentioned, even the cancers of the blood, because cancer, all this abnormal development of cells can occur in any body part, can occur in the bloodstream, can occur in the bone marrow. So the incidence of cancer generally in lower middle income countries like Nigeria is on the rise. So what can we do as a people to ensure that the first thing to do is to be aware. You need to be aware that, yes, it does happen. It's not something that is strange or far off, because a lot of times what happens in our part of the world is late presentation. People show up late, not because they didn't know they had a breast lump, for example, because something like breast cancer, the first indication most of the time is the woman feels a lump in her breast. So you must be aware. For women, do, for example, self-breast examination. That doesn't require you going to the doctor. You can, if you go online, you just see how to get it done. It's very simple. You can do it yourself. So be aware of those things. And when you do it, please seek medical attention immediately. More than, I would say about 60% of the patients we see here, we give palliative treatment to. And palliative is a fancy word for saying we can't cure the disease. We're just going to help you to be comfortable till you eventually die. And that's sad, because if those same patients had presented earlier, there's a likelihood that the cancer would have been cured and they would have gone on to lead entirely normal lives. At NSIA here, NSIA LUTH Cancer Center, we have a plethora of treatments that are available to patients. In cancer, you could do the several modalities of treatment. It depends on the part of the body that has been affected by cancer, and depends on the stage at which the patient presents. But the general things that you would do, one, you could do surgery. So for example, in breast cancer, you can take off the breast if you catch it early enough. You want to remove the tumor and then a sort of large margin that ensures that you've taken the tumor out wholly and you're leaving only healthy tissue in the woman's body. Then there's also radiation, which is what we do here for the large part, external beam radiation. The machines we have are the latest and the best in the country at the moment. So we have external beam radiotherapy, there's internal beam radiotherapy, and by that they're giving more targeted radiation to the organ itself. And we have the skill, the NSIA Youth Cancer Center has the first 3D brachytherapy machine in this country for treatment of cervical cancer. We're sending radiation directly to the cervix. In the past, when radiation therapy was delivered, the challenge was it would damage the cancer and kill the cancer cells, but because it wasn't specific and targeted enough, it would also damage normal cells. And that's the reason why people would have radiation burns. Sometimes they would have diarrhea because radiation is getting to other organs that are entirely normal. But in the course of treatment, that was what would happen. But the machines that we have now are very precise, and they have very little or no additional damage to a normal tissue. The other modality of treatment that we do here, or that you can have for cancer, is chemotherapy. And by that I mean you're giving systemic, very powerful agents, pharmaceutical agents, to target the cancer cells and destroy them. And one of the side effects of that, I'm sure we've all seen it either online or seen people that have cancer. Again, it's the same thing of, in the process of destroying the cancer cells, you end up destroying normal cells, which is why sometimes patients on cancer treatment would lose their hair, the hair falls out, the eyebrows fall out, all those sort of things, because that's normal tissue. And then one of the other therapies we do here is electron beam therapy. Electron beam therapy is given for things like skin cancer, superficial tumors. That's also a treatment modality that is not very common in other centers within the country. So those are some of the treatments that you could do for cancer. If we begin to talk about very advanced treatments, there's SBRT, also called cyberknife stereotactic body radiation therapy. And that is, again, even more precise than the therapy we do here. That is one of the things we're working on developing a capacity for at NLCC, to be able to deliver cyberknife treatments to patients. But again, the beauty of that will be when we get patients that present early. If the patients present late, the tumors are too large, even when we develop capacity, we won't be able to really apply these things. So I would say what NLC, one of the things that we're trying to do as an establishment is raise awareness about cancer, not just in the business, we're not just in the business of treating cancer, but raising awareness about cancer, because being that we're in a low and middle income research challenge environment, it is key to focus on prevention and not just treatment, because treatment is expensive. Yes, the government can commit funds and resources to cancer centers, but it's not just the equipment, it's also the people. Do we have the human resources to staff all these things? Because it's not just the doctors that are necessary. You need oncology nurses, you need medical physicists, you need therapy radiographers, a whole ecosystem of human resources to be able to support these facilities and deliver the treatment. And that's more expensive. The cheaper thing to do is to ensure that people don't even get cancer in the first place. So NLCC, what we're trying to do through our social media pages and consistently through all forms of media, this month, on the 4th of September, on 4th of this month, we have World Cancer Day, and the whole of February at NLCC is dedicated to educating people about cancer. And not just this month, actually, the whole of the year, but especially in the month of February. We have, so I'll just run you through the events that we have. We have starting on the 4th, we have a 21-day challenge, a Healthier You challenge. Every single day we're going to put things out that you can do to be healthy. So sometimes it will be take a walk, sometimes it will be make sure you drink water so you're well hydrated, sometimes it will be eat a healthy meal, eat a salad, different things that you can do. And then we plan to put that on social media, have people tag us, take videos, and tag us when you do those things that we're challenging you to do. Sometimes if you sit down and meditate, calm yourself. There's so many things going on now that people are dealing with. It's not fuel scarcity, it's electricity, it's trying to get money from a POS or an ATM machine. So all of that is enough to really stress you out. But you can sit down, be mindful, be conscious of the fact that yes, I'm stressed, and find ways to calm yourself down. That in itself is contributing to your health. So we're going to do that for 21 days. Somewhere in the middle, we're going to have a quiz where we're trying to find out what the public knows about cancer, and we would be giving out prizes at the end of the quiz to the people that get the answers correct. And we hope to have some of the prizes will be, apart from simple regular things like airtime, mini health checks, so that you can go get yourself checked and know about your health status. We're also doing, on the 11th of February, we will be having a Zumba session. Now, Zumba, lots of times when healthcare establishments want to raise awareness about things, they do a walk. And a lot of centers are doing 5-kilometer walks and all of that. We wanted to do something different, something fun. Because a lot of times when people think of health, doing the healthy thing sort of is, oh God, it's difficult, it's not fun. But Zumba is dance, is exercise with dance and with music. And we wanted to let people know that you can be healthy and it is fun. Staying healthy is doable. So on the 11th of February at Oniru Beach, we're inviting the general public, as many people as can join us, but registration is required before you come in, to come in and join us and do a Zumba session to help improve their health and raise awareness about cancer.
Thank you so much.
And I'm Dr. Lilian Ekpo, Center Director at the NSIA Youth Cancer Center. Thank you for having me.